Hi everyone, this is Meera from Singapore Management University. I'll present our work, which is an empirical study on gym usage behavior and decide digital interventions. Regular physical activity is essential to maintain good health, to stay fit, and for our overall well being. As individuals become more aware of the benefits of engaging in physical activity, the prevalence of people going to the gym or fitness centers is in the rise. Recent statistics report that the number of fitness center memberships in the United States has steadily increased over the last decade. However, one major challenge is the retention of the gym users. Little is known about the dropout problem and the contextual factors that seem to affect such dropout behavior. We do not know why people quit their gym activity after initial few visits. And another problem is the increase in injuries that are sustained at the gyms. And this may be probably due to the lack of knowledge in using an equipment or not knowing the right technique for certain exercise. Now, while there has been a rapid explosion of mobile fitness apps for promoting healthy behavior and quantifying workout activities, prior works report that most of them follows a one-size-fits-all approach and do not provide personalized suggestions or feedback. Given these facts, we focus on studying the gym visit habits of individuals. As such, we target to answer the following questions. First of all, what forms of failures exist in gym participation? And what are some key reasons why people drop out or quit their gym activity? Then, what do people desire to overcome such failure in participation, or how can they sustain their gym participation? And also, are there any specific preferences in technology that people want to use while exercising in a gym? To study these or to answer these questions, we utilize two rich sources of data. First of all, we obtain the gym visit transaction logs from our campus gym in Singapore. So we obtained the gym visit patterns from the data that was captured through the card transaction logs. So it contained both the entry time as well as the exit time of each user, which was tagged to their ID card. And it also logged other demographics information like gender, the school of study, the student versus staff, etc. So as such, we obtained data from over 6,500 unique individuals who visited gym over a longitudinal period of 16 months. So this involved more than 90,000 records of gym visit data. And the second source of data was from a survey, which we conducted at our university gym as well as other public gyms in Singapore. So with the study, we obtained survey responses from over 615 individuals. And this was also conducted in multiple phases. We first studied the aggregated gym visit patterns. When we looked at the weekly visit pattern, we found that the daily number of users keeps dropping as the week progresses. And we found that Monday was the most popular day with an average visit count of about 350 users. And this pattern was also seen across the time for the time of visit, where we saw there was a peak during the morning hours and there was a peak after office hours, like an evening peak. But during the day, the number of users using the gym kept dropping. We also looked at the visit pattern during an entire academic term, which spanned over 16 weeks. And we found that the total user count tend to drop gradually as the term progresses, where the number of new users, incoming users kept dropping, whereas the dropout of the users kept increasing. And this dropout was also more evident when when the students had exams, etc. Prior works in behavioral literature has shown that the temporal consistency helps maintain exercise habit. So we next looked at the temporal visit pattern of their gym usage, and by obtaining the cumulative probability distribution of the visit count, we found that 65% of the users have less than 10 visits to the gym during this 16-month study period. And also about 32% drop out after their first one or two visit. This demonstrates that Even in a gym where most of the gym goers correspond to the student population, there is a significant set of users who drop out from their gym activity. Next, for the users who had less than 10 visits, we looked at their behavior and again found that 80% of them dropped out within the first month of joining the gym, and the remaining 20% were very infrequent users who visited the gym in the first month and maybe came back after 4 or 5 months, like that. So, given that there is a high percentage of users that sees gym visits fairly early on, we were interested in understanding if there are any distinguishable behavioral pattern between regular versus dropouts. And we first looked at the visit pattern separately for individuals versus those going into the gym as groups. For this, from the gym visit logs, we extracted the people who visited the gym as a group. That is, we found those repeated user groups who had both their entry and exit time differences within 1 minute, and we were able to obtain over 1,000 occurrences of such repeated groups of 2 to 4 users. And from this data, we found that people going in groups visit the gym a greater number of times than people who go alone. There was about 45% of them who were going in a group had a visit count that was greater than 10, whereas only 18% of the those who go to the group as themselves or as a solo had greater than 10 visits to the gym over the 16 months period. Similarly, we found that the regularity in terms of the schedule of their visit, like the time of their visit as well as the day of visit, was also important in terms of the sustainability in their gym participation. We found that those with visit count less than 10 had a greater irregularity in their times of visit, which varied by 4 to 5 hours, whereas the difference in visit times for about 85% of the users who had a visit count greater than 10 were within the limit of 1 to 2 hours. So this indeed shows certain behavioral aspects that help to sustain gym participation. Now, having obtained an understanding of the gym visit patterns, we next want to identify the key reasons why people quit their gym activity. So for this, we utilize the survey data from the 615 individuals. And in the survey, we asked them the questions on the reasons for their dropout, like what are the desired features that they would like to sustain their gym participation? Are there any specific preferences for digital technologies? And if there are, like, what are they, and what are some of the reasons they do not prefer certain technologies? And what are some key services that they would like to obtain from such technologies, etc. So, first of all, we study the dropout reasons. For this, we obtained data from these 97 users who reported that they stopped their gym activity because of certain reasons, and that we exactly wanted to find out what were those reasons. So we gave them a set of reasons like lack of time, lack of knowledge in using gym equipment, other reasons like not having social support or medical reasons, etc. And we found that while lack of time was the most important reason, the other key reasons included lack of personal trainer, lack of knowledge in using gym equipment, followed by lack of enjoyment. So as I mentioned, not having a personal trainer and not knowing to use certain equipment were some of the top reasons why people stopped their gym activities. And these percentages are obtained by combining responses that were rated as extremely important and very important on a 5-point Likert scale. And also there were other reasons like not meeting their goals or expectations, or they prefer some other workout like outdoor workout, etc. But this question did help establish some of the key reasons why people tend to quit their gym activity. When asked about the desired features to continue gym activity, people mentioned that after providing more variety of exercise machines, the next top reason was providing personal training recommendations. So This shows that individuals do need some guidance during their activity, like they would like for somebody to help them train or help them with the techniques of certain exercises, etc. But again, we all know getting access to a personal trainer is not easy. It's expensive, or it's not readily available for everybody, etc. So what do we do? Also, plus we want to know what individuals need from a personal trainer. So we then ask them about the need for personalized monitoring. Then people mentioned that having access to a personal trainer at the gym was very valuable to them. Like over 60% of them responded this as very important. And when asked about the most needed services, people mentioned that helping with correcting their body forms or postures, or teaching them how to perform specific exercises were very important services that they would like to obtain from a personal trainer. And again, like I mentioned, a personal trainer may be hard to get. So how can digital technologies help be a personalized coach? So given this recent trend among quantified self, or the explosion of mobile devices, we also wanted to know the preferences of people in using certain digital technologies. So we specifically asked them about their adoption of a wearable technology versus non-wearable technology, which was like maybe a machine sensor, like a sensor that is being attached to the exercise equipment, so that the person itself do not have to wear any devices on their body. And while overall individuals prefer to use some solution to quantify their workout activity, we were not sure exactly what kind of technology they wanted. And we found that 60% of them indicated an unwillingness to use wearable based technology to track gym exercises. This difference was more evident in the older adults, where 82% of the users in the 55 plus age group were reluctant to adopt wearables. And this is also in accordance with the reported digital aversion and the lower likelihood of using technology among elderly. In general, the main reasons for the version towards wearable-based approach was the discomfort of wearing on-body devices, or the inconvenience of requiring to wear multiple such devices for proper exercise tracking, or like forgetting to wear these devices while going to the gym, etc. And also there was an exception that people do tend to use devices like the earphones for listening to music. So among the wearables itself, these earable devices was an exception, that people do not mind using such devices even while working out in a gym. Therefore, in summary, using the gym visitation records from over 6,500 users for a period of 16 months, we established the cuteness of dropout. We found that more than 32% of dropout people drop out after their first one or two visits, and those visiting gym in groups and also having a regularity in terms of their time and day of visit had a higher retention of their gym participation. And also, based on a survey of 615 individuals, it was reported that getting personalized monitoring and real time feedback is one of the most valued features to sustain gym participations. And people also indicated, like over 60% indicated a reluctance to use wearables while exercising in gym, with the exception of earable devices. So overall, this work established that there is a need for better mechanism to sustain gym participation, and the digital technologies should be more personalized, or they should provide real-time useful feedback in order for people to find it more useful. And maybe integrating motivating elements and interventions at the right time may help retain their long-term participation. So we hope that the insights presented in this work will be helpful in designing future fitness solutions and digital interventions. Thank you.